Hello. Alrighty. Whenever I can't be bothered studying, I want to do something that's like, it's not completely unproductive. I don't know. I have this weird thing where I always like need to be doing something. I feel like I get antsy if I don't have something to do or keep my mind busy with or occupied with. Video games are like the perfect thing in the world. And like, I'm on a mission to make video games like part of like learning and like the skill set that you can, you know, I'm like on a mission to like make video games a part of like the medical school curriculum. I feel like there are some video games out there that actually genuinely help you learn medicine. And I don't know, I feel like the dexterity, the tools that you can use, even like with the uprising of like VR and stuff like that, there are so many cool tools that you can use to actually learn and practice medicine that, you know, you may not actually have the exposure to, especially with like laparoscopic stuff, robotic stuff, you know, even just basic procedures that you can try to practice with VR. I feel like that would be an unbelievable thing to get good at in the future. So this is the start of a future series where I'm going to be taking on different video games, different medical video games that I come across, and see what I can find and show you guys what I think of them and if they actually help you learn medicine and stuff. So anyways, this is probably just an excuse for me to not study or not be doing other stuff with regards to furthering myself in my career, but that's okay. This is an excuse. So anyways, let's go through the first game that I fell in love with a couple years ago. I actually played this during, I think it was one of the conferences. We had like a conference during med school. Essentially, one of the workshops was to download this app and get super good at it. And I mean, like the whole workshop wasn't about that, but like you could do this app, you download this app and essentially just played it, and they gave prizes to whoever got like the highest score. So instead of listening to like other talks and stuff, I just abused this game, played it so much, and ended up winning a free pair of socks that I still wear today. So yeah, that's how much I enjoyed this game, and I think it's like super cool. Anyways, let's go through it. It's called Gastro EX. This is what it's like. All right, so this is really cool. So essentially, like once you like log in and stuff, you can go through different units, and it's essentially like a colonoscopy app that you can practice doing actual real life colonoscopies with and procedures with it. So, I mean, you can start off basic one, polypectomy. Now, people get these polyps in their colon, and we can actually go and find it. So look at this. My best score, obviously up the top there, 30,590. I've played this level a few times. They give you a cool case, which is nice. A 62-year-old female patient has some, it's just for a surveillance colonoscopy. And yeah, a few years ago, there was a 5 mil adenoma. And yeah, now we're just like doing another colonoscopy to check up to see if there's any more polyps that have developed since that time. So our objectives on the side, reach the cecum, as you can see, over the other side, and remove the polyp. So let's do it. Now, there's a time limit there. You essentially can just like move with your thumb on the screen, and I mean, your aim is just to go forward and find the polyp. And you can just advance on this side. Look at that. So you got to torque it because we got to get around this. So you go torque, and advance. Oh, we found the polyp. And there's the end. There's the end of the large bowel. There's instruments there. Like, this is so cool. We can get the forceps out, advance it. Oh, here. Extend the forceps. Move closer. I'm gonna get closer here. Oh, let's pull this back. Open forceps. Oh, and we will grab it and then pull back. Got it. How cool is that? Case complete. And they give you stars based on how cool it is. Not how cool it is. They give you stars and points based on how quickly or how well you completed the case. I don't know, I just think this is like one of the most, like the coolest thing ever. And I think going through this game and then seeing like a polypectomy in real life. I remember the other day I was with my consultant in like a scopes list, and essentially I showed him the game and I was like, look, I've been practicing, not actually in real life, but you know, on this game. And he was like, oh, this is really cool and stuff. And then he's like, oh, not as easy as it seems. I'm like, yeah, I know. Definitely not as easy as it seems. Yeah, all right, let's go through this next one. Vascular malformation. So a 50-year-old guy has screening colonoscopy. Our objective is to treat the AVM. So essentially you just go through these cases. You have a time limit. You even have like a lifeline up the top, and like the controls are on the left side. I mean, I just hold it like this. So you essentially hold it like a controller. You know what I mean? Let's have a look. Let's go find it. Oh, there it is. So we've got this little AVM here. Use instrument. So we have a little APC, little cautery device. All right, and you just zap it. See? Hold it down. Done. Case complete. I don't know, I just think this is cool. They give you a case, they give you like the instruments to use. Almost beat my best score. But yeah, and then you can just keep going through this app. All right, next case, rectal bleeding. 18-year-old guy presents for an initial visit. Daily rectal bleeding for the last 8 weeks. Most stools are loose. Prior to this, had some diarrhea. He did not previously seek care. All right, crampy, low, and weight is grossly stable. All right, so let's go have a look. So we actually get to like go into the colon like that, like straight up. Look at that. Look at that. So obviously very like abnormal looking colon. All right, let's choose diagnosis. Ulcerative colitis. Done. Do we beat it? Do we beat our score? Yes, we beat our score. How good's that? Case complete. Yeah, I don't know. I think it's like really cool way to do it, and you know, you could keep going through. Like there's just so many different cases. Like there's another like couple units where you get to do like more complex stuff. Like this one, we get to remove all the polyps by like doing the snare. So a snare's like a hook. I mean, I'll just show you, but essentially you go find the polyp, and we can actually use the instrument like a cold snare to go do that. You open it, and then you essentially close snare, and you get it. How good? And then we put the instrument back, and let's go find the others. I think like doing this, I mean, like obviously they don't like pop out to you like how they do here with like a little flag that just says like polyp on them, you know? Oh, and it's obviously harder to do than this because patients are like moving, they're breathing, and essentially like you've got your, like I'm not doing the actual colonoscopy like this with my hands. You have to like hold it across your shoulder and then like angle the scope, and yeah, you use your hands in a different way, but it would be cool if it was like an actual like remote controller. All right, lurking lesion. 48-year-old guy, no past medical history. Doctor did the test, but he doesn't know any details, and he has some bowel symptoms. Cool. So apparently, like, there's a big polyp here, or a flat polyp. Oh yeah, because, so I guess with this, let's move the scope back. It's really hard to get this. So what we're gonna do is we're going to inject some stuff into the polyp to get the needle out. Oh yeah, here. That's good. I don't even know if I'm, oh yeah. Now let's do it. Inject saline to raise the polyp. Yes. Put the needle back. Oh, decided to throw some water in there. Now let's get the snare, because we've raised it up. All right, done. How good's that? I don't know, I just feel like it's cool, because like you wouldn't normally know how to do this stuff, and in the most simplistic way possible. Obviously, there's so much more to this in real life with the actual equipment than it is. Oh, we did this. We did the lurking lesion. Yeah, that's what we did. Uber Eats telling me some discounts. But we have some more ones. Sorted AVMs. I think just being able to see and do the case in like a fun way helps you learn so much. Like, it's so much better than doing like a lecture or obviously you can't make everything a game. I get that. But I think if there is a way in which you can make learning enjoyable or make it more approachable and I think engaging, then I'm all for it. So yeah, that's the best thing about something like this, is that it's a really well thought out app. They're quick, they're simple, it's easy to use, it's intuitive. Like you have like scores, like that's sick. You have like a little case, so it's clinically relevant. And you just get to do it yourself. Like, it's very procedurally focused. And I think you can do the same thing with other different things. And like there's different ways in which, even if it's not a procedural thing, you can show the people, show students, med students and junior doctors how something works. Or I don't know, you could do it with like medications or different pathways or different patient scenarios if you're trying to like diagnose people. And I guess that's why I think at uni I really liked our cases. I really liked our cases that we did each week. So on Monday we would start off the case and spend all the week, we would spend all the week trying to like work it out. On Friday we would actually, go through everything that we've learnt in the lectures. And the lectures during the week were supposed to help us solve the case. And on Friday we would like work it out, and everyone would like pitch in and like help solve the case for the week. So I can't remember what they were called. They're like, anyways, we had like these weekly cases that we would do. And that was like way more fun than the actual lectures, which were pretty bland. So yeah. Anyways, let's keep smashing this game. I'm planning to clock this. All right, 65-year-old lady, osteoporosis, hypothyroidism, chronic back pain. She's been taking anti-inflammatories chronically, near syncopal episode. All right. And she's a bit hypotensive. She's got a dark stool. Her hemoglobin's a little bit low. She's a bit hyponatremic. All right, let's do this. So let's go find these like little AVMs. So let's cauterize this one. So she's probably bleeding from these things, hey? think you don't really appreciate how difficult these things are to actually treat. I mean, not just like these AVMs, but like colonoscopies can actually be like pretty difficult because of the whole movement thing. I think, I can't remember if it's in this case, but like you get an APC or you get an AVM that actually like bleeds, and you have to like control the bleeding. So you actually get like complications from this, which is another level, which is why it's so cool, this game. Let's just talk back here. Yeah. Oh, see? Manage bleeding. Oh, I'm just going to cauterize more. Look, oh shit. Bleeding tissue. Burn damage. Wow. See, and I like damaged that guy's health. I forgot it was this one, but like, yeah, obviously like these things can happen. I reckon that's so cool that you built in like this complication to this app. Oh look, can we suction this? Epinephrine? Should we use epinephrine for this? Don't know. Maybe. Oh, unnecessary injection. I mean, it was just in my tools, so I thought maybe we could use it. Let's go back here. We should probably just like fix this patient. Yeah. Let's just control the rest of this bleeding. Burn damage. Oh, I'm making a mess of this. Case failed. All right, let's just try this again. I thought I just had to like zap more of that AVM. I don't know what they wanted me to do. So like, we'll go to this one and we'll just zip through this. Done. So that's a quick one. They don't want me to fail on that. But then this one. Done on that. All right, that's speedy. Obviously we don't want to race, but I'm trying to think like, what do they want us to do? Like, do I inject initially? Oh, bleeding avoided. Okay, nice. Nice. All right, we do that first. That's good. Please don't bleed. Oh, done. I think that's the best one I've done that so far. Yeah, give me heaps of points. Look, I'm gonna smash my best score. Yeah, I think all the times previously I've just like, you know, made that like person bleed from just like zapping it. I didn't put epinephrine in, like adrenaline beforehand. Cool. And you like unlock the levels as you go. I think this is like just such a good way of doing it, you know? All right, what have we got next? A 24-year-old lady, 6-month history of intermittent diarrhea, occurs up to 6 times per day. Blood when wiping. All right, she's lost weight. How old? 24-year-old female. Diagnose the patient. She's got right lower quadrant tenderness to palpation, and then a little bit of an elevated CRP. Let's just zip through this colon. Oh wow, what do we got going on here? So it was fine before. This does not look good. I can't remember if this is Crohn's or not. I think it's Crohn's because it's not like continuous. I think. Like that's fine there, that's fine. Let's let's just keep going. Look at it, talk. We're gonna keep going. So this is like transverse colon now, you know, like the triangle shape. It's kind of cool. Is it gonna show me more stuff? And we're coming down to the descending colon, almost. Yeah, see, it's like skipping lesions, right? So I'm pretty sure this is Crohn's. So we've got a bit early on. Yeah, and let's just keep going because this is all like normal colon. It's just descending colon now, I think. And I'm guessing we might have some more. Oh, extent reach. Okay, let's diagnose. I'm pretty sure this is Crohn's because it's like a skipping like lesion. Yeah, nice. I don't know, I think like seeing that like, and then when you do the colonoscopy in real life, or you just watch it as like a med student, like you get to actually realize, oh, this is what they mean by skipping lesions. Like you actually see normal colon, then you see abnormal colon, and then you see maybe some more abnormal colon after that. So I don't know, I just think seeing it, doing it. Oh, which one should we do? Wow, we've got some good ones. Let's do the surprising sigmoidoscopy. All right, 67-year-old guy, end-stage renal disease on dialysis, presents for evaluation of anemia. He did a scope 2 months ago. Normal exam, they did biopsies. And then he's got an FOBT, so like fecal occult blood test. That's like the blood test that you do that picks up if there's any bleeding that you can't see. And then if that's positive, then you go for a scope. A little bit anemic, and I don't know, these are all like MCV. I'm not sure if that's low or not. Ferritin, that seems low. Maybe he's got iron deficient anemia. All right, take 5 samples. All right, so we've got to take some biopsies. Ooh, okay. Ooh, no. He's got that cancer. All right, so obviously we can't just take this out. Like he needs like an actual like operation to remove this. Maybe like an anterior resection or something like that. But yeah, he definitely needs like a big resection, discussion at like the MDT, staging, everything like that. So we're gonna just, we have to tattoo as well, but let's take some samples. So let's open, close. We've taken 1. Obviously we'd have to take this all the way out. Grab. Oh, I didn't grab anything. And grab, pull that. Let's grab this, pull back. Let's grab, that looks pretty abnormal, and pull back. And let's go forward and grab some other stuff, like some of this stuff. Grab that and pull back. Okay, tattoo proximally and tattoo distally. Now, I thought the convention was to tattoo distally, but let's just go back. Oh, see, this is cool. Like it actually gives you the region to do the tattooing. Excellent injection. All right. Cool. All right, let's pop the needle away and let's just go around here. Try to get past this mass. Inject tattoo. Yeah, I thought you'd do it. Only, we've done that. Oh, see, I shouldn't have done that. I shouldn't have moved the needle in the actual patient. That was bad. That was bad. All right, let's just do this here. Put the needle out, pop it in, done. Take it away. Oh, dude, that was really cool. So now you do it so you can do planning when you do the scanning and everything, and you know, yeah, where to like actually do the resection, where the mass is. But yeah, I thought the convention was distally, but I might be mistaken. I'm not an expert in like colorectal stuff, so yeah. All right, next unit unlocked. Woo! All right, this is so cool. Like, I just think this is anguish. What's like, they just go through everything. Let's go through this like level 3 one. Like, this seems, oh, this is like detailed. Achieving 3 hearts on this level will give you CME credit. Cool. Take the sample, answer pop-up questions as you go. So a 70-year-old woman with a history of hypertension, recurrent UTI, comes to ED, has pain in her tummy and loose stools. And then she had non-bloody diarrhea for the past week. All right, history of IBS and bouts of diarrhea. Hasn't done that. All right, she's completed a course of antibiotics recently for a UTI. A little bit on the anemic side. The white cells are a little bit up. 75% neutrophils, I think that's high. Stool evaluation pending. Sure. All right, play case, let's do it. Examine the colon. Oh, this looks, what is this? This looks weird. All right, let's just take a biopsy of this. All right. Diagnose the patient, tap to answer. Yeah, is this, I guess it's C. diff, but I actually don't know what C. diff looks like, because the only thing I got from C. diff is that they've taken antibiotics. All right, so yeah, blah, 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 blah. All right, it causes ulcer formation, which promotes mucus, proteins, and inflammatory cells release. Pseudomembranes appear as raised yellow or off-white inflammatory caps or plaques that are up to 2 centimeters in diameter and scattered across the mucosa of the colon. Yeah, that's really cool. All right. Using the American College of Gastroenterology, how would you rate this patient's disease? Well, mild to moderate. I mean, the white cells are elevated. I don't think it's complicated. Mild to moderate? Yeah. All right, let's see. Oh, this is cool. So like, look how like much information you're doing, and like, because it's like a case, because you're playing a game, you're actually like learning as you go. I think that's like such a cool thing to do. Sure. All right. So the reason why it's mild to moderate is that it's symptoms and there's no severity. So severe diseases, if the albumin's less than 3, I'm pretty sure it was 3.5 or 4.2, I can't remember. White cells were more than 15. They weren't, they were like 13.2, or abdominal tenderness. So I think she had tenderness, right? Complicated disease, fever, ileus, or distension, and then end organ disease. Okay, so she doesn't have that. Cool. Next. So the guidelines, which is the following best initial treatment? Well, I think you treat C. diff with Vanc. Do you? Or Metro? I can't remember. Clostridium. I feel like that's a Metro. No, it's a Vanc. Whoops. I was right, obviously. Vanc. Yeah, I should have done that. So vancomycin and fidaxomicin are not available. Metronidazole is recommended as an alternative. Okay, so Vanc is the first line over for an initial episode of C. diff. All right, in both non-severe and severe cases. Strong recommendation. Okay, so 10 days of vancomycin. Cool. Nice. Which method of bezlotoxumab administration lowers the rates of C. diff infection. Well, I have no idea about this, so let's go, because I think C. diff, like, you get it from like an antibiotic, like disrupting like the microflora and everything of the gut. So weekly, I don't think it's weekly. I don't think it's an infusion and you give IV immunoglobulin. I think it's just during the administration of an oral antibiotic regimen. I feel like that's pretty reasonable. See how you just think through stuff like that? Like, I feel like that's pretty good. I worked it out pretty well, you know? All right, what have they done? When used in conjunction with the standard oral antibiotic, there are significantly lower rates of recurrent infection compared to just using the oral antibiotic alone. Cool. And then there's some adverse effects. I think we did pretty well. Case complete. And we got some CME credits as well, so that's pretty cool. See how many hearts we get. I don't think we get 3. I don't think we did that well. Yeah, try again. Sad. Oh well, I don't need the CME. But yeah, anyways, I think we can go through more cases, but this is honestly one of the best apps that I've found so far. And what a perfect way to start off the series with like, okay, so obviously we're playing that game for like so long that it all cut out and stuff. But yeah, I don't know, that game is like one of the coolest things ever. I think, you know, I don't know, like I feel like if you're gonna play a video game and actually like learn some stuff, like this is the one to do it. And I know there's a couple of new games, there's a couple of other games from this company that I really want to try out. There's Palm EX, there's Cardio EX, and there's something else I'm pretty sure as well, Derm EX maybe. And they have all these cool things, and it's like case-based, it's game-based, you just play it on your iPhone and see how it goes. And I think they're honestly one of the best ways to learn and actually study and get like knowledgeable about the actual information that you need to know on a practical basis. You learn, I think, most of the time through cases and through patients. And if you can recall like a particular, you know, like think about it like this. I think this is like the best way to do it, is that when you spend time with your friends or when you spend time with family or people and you're talking at the dinner table and conversations and you bring up stories, you know, because people remember stories. And I think in terms of medicine, it's very hard to remember lecture slides and textbook paragraphs, and sometimes diagrams are a little bit separate to that. I mean, if there's a particular diagram that you really resonate with, then that actually is pretty cool and you will actually do really well if you can recall that diagram and explain that to another person. But for by and large, like lectures and talks and text is not memorable. So what you base it on is cases and patients that you've seen. When you hear about consultants doing teaching sessions or registrars doing teaching sessions, when you're listening to these, they refer to cases that they've done and that they've experienced in real life. So I remember I was watching this, case. I was watching this recording from one of my old registrars, and she was just talking about, you know, a case that was being presented to the junior doctors we had like a structured teaching session to. And then at the end of the case, like the takeaway from it was, consider this diagnosis in this group of patients. I remember when the other week, she said the last year, she had a patient that was very similar in this particular age range. And that's why she always thinks about that diagnosis, even if someone's of that particular age. And I think that's the thing, because you learn based on your clinical experience and the patients that you treat or look after or help manage their condition in hospital. And even me, like I remember the patients because of their particular story or because of a particular skill that I learned whilst I was treating them or looking after them. And that's the main takeaway with everything. So I don't remember the lecture slide on a talk about, you know, colorectal cancer or polyps, but I remember playing a game and actually removing the polyps with those different types of instruments. So I have that in mind. And, you know, I remember that case that we played just a moment ago where we had to zap all those little AVMs. And there was one which bled the first time, and then the next time we went in and injected some adrenaline to like close up the blood vessels, and then I zapped it. So in my head, like that's an option if something's high risk at bleeding. So I don't know, I feel like you want to make the most of your learning by doing stuff that's engaging and almost gamifying it in a safe way. You know, obviously medicine is not a game, but if you can make your learning into a gamifiable sort of engaging way, then if that's going to help you remember stuff, I think I'm all for it. And I'm very much all for incorporating this sort of stuff into the curriculum in the best way that we can. So yeah, anyways, hopefully that helps. But again, it's just an excuse for me to play video games, to be honest. So yeah, let's leave it with that. I'll see you guys next time. Don't watch me. Time to download the next app.